Dr. Praveen Changala, consultant neurophysician at Aware Gleneagles Hospital, LB Nagar, Hyderabad. Today, I would like to share my views regarding epilepsy and seizure. So, basic difference between epilepsy and seizure is a seizure is an abnormal synchronous discharge of neurons in the brain, leading to involuntary movements of the body called convulsions. So, when there is a tendency of the brain to have repeated seizures, that is called epilepsy. So, seizure and epilepsy are two different terms because epilepsy has a significance because it is a disease where a special care is required. So, how do a patient know whether he is having a seizure or epilepsy? Most of the times during a seizure, patient will be unaware of the events what are going on. So, usually it's a clinical diagnosis which is diagnosed by the patient depending upon the history given by the bystanders when the patient is having a seizure episode. So, what precautions to be taken, especially during a seizure, patient should be left free to have normal oxygen levels, and anything should not be kept in hand. Especially, there is a norm that usually a keys or iron thing, if it is kept in the hand, that will lead to aborting of seizure. But that should not be done. A pillow should be placed underneath the head, and nothing should be placed in the hands or in the mouth. And after this conversion has been settled, the patient has to be turned to one side. And after patient is fully conscious only, then we have to do anything from the mouth. Usually following the instructions of the doctor, being under regular follow-up, and using medication properly and avoiding stressor. These are the main things should be done by the patient to keep his seizures or epilepsy under control. Thank you.